Hello, everyone, and thank you for joining us for Healthline 3. I'm Carly Flynn Morgan. Today, we're talking about the topic of cardiac arrest and CPR with Dr. Paul Bracey of Urgent Care of Louisiana. He'll be answering your questions for the next half hour, and we want to encourage you to ask what's on your mind. If you're online, just click on the orange Healthline 3 box about halfway down the right side of your screen. Type in your question and submit it, or just give us a call. The number is 318-219-4569. It's right there at the bottom of your screen. That'll stay up throughout most of the show. We'll be taking your questions live from now until 12:30. Dr. Bracey, thanks for being here with us today.
Hey, how are you?
I'm great. How are you doing?
Good.
Very good. Well, let's start out by talking about what exactly is cardiac arrest. You hear people talk about a heart attack all the time, but what exactly is happening?
Well, what's happened is that the heart has more than likely entered an irregular rhythm, and the mechanical function of the heart has ceased. So we kind of think about the heart in two different forms, one in the electrical aspect of the conduction of the electricity through the heart tissue, and the other as the heart as a pump and its mechanical function. And so cardiac arrest occurs when the mechanics of the heart are no longer moving blood through the heart and through the rest of the circulatory system. You may or may not have electrical activity even though you don't have mechanical activity. And so that's where CPR comes into play, and that's also where these electronic devices that people probably see posted in many different venues, whether they're sports venues, the airport, the mall. These are called AEDs, or automatic external defibrillators. And that's why those devices exist. They're kind of an extension of what we use in the hospital setting.
Are there certain people who are more at risk to be in cardiac arrest than others?
Yeah, about half to 3/4 of the cases of sudden cardiac arrest are attributable to coronary artery disease or coronary heart disease. So those people who have coronary heart disease tend to be at a greater risk of suffering a sudden cardiac event or arrest compared to people who do not have coronary artery disease. There are other risk factors that also closely go with risk factors for heart disease. You know, smoking, excessive alcohol drinking or binge alcohol drinking, high free fatty acid levels in our bloodstream, so things like that, but which also kind of go hand in hand with coronary artery disease risk factors. But there are some other inheritable or genetic predispositions to sudden cardiac arrest that have more to do with how the electricity flows through the heart as opposed to the disease of the arteries of the heart.
Are there signs that people can know that maybe they're going to be going through a cardiac arrest very soon? I know you said it's very sudden, obviously, but I've heard about the pain in the left arm. Is that true?
Well, I mean, that's a fine line, kind of trying to distinguish the difference between, say, a heart attack, which is different than sudden cardiac arrest. So, you know, a heart attack is considered mostly a cessation of blood flow to a certain area of the heart, and may or may not lead to a sudden cardiac arrest. You know, so there's a little bit kind of a nuance, a spectrum of illness or timing of the event. Most issues with coronary artery disease kind of have some warning signs that show up beforehand, and those many times are related to chest discomfort or heaviness, pain in the left or right shoulder. It can be either side, left or right arm. The original, you know, textbooks used left-sided chest heaviness and pressure and left shoulder, left jaw pain as markers for a angina or you know, not enough oxygen getting to the heart muscle. But those are not the only way that it happens, and in fact in women it tends to be less those symptoms and more easy fatigue, breathlessness on exertion, things like that. Women tend to report fewer episodes of chest discomfort than men do. So the original studies that looked at classifying those symptoms were only included men. So those symptoms are more male kind of predominant.
So those are the ways you yourself can kind of tell if something's wrong, possibly. What about for people coming across someone having an issue? What are the signs that they are in cardiac arrest and that they need CPR?
Well, someone who's in a cardiac arrest is going to be, they're going to be lying down. First of all, it's going to be your first clue that something's wrong, is they're going to be on the ground. You've lost blood flow, you've lost all blood pressure, you've lost blood flow to the brain, so you collapse. That's usually the first sign that anybody has, that somebody is going to develop sudden cardiac arrest, because it is a sudden event. There are really very few warning signs. Some people, very few people, will have, who are, I guess, victims, for no other better term, of sudden cardiac arrest, will have a very short or brief period of some symptoms beforehand, like dizziness or feeling like they're about to faint, but they're very brief. Usually sudden cardiac arrest is a 1 second you're okay, the next second you're on the ground. And so lying on the ground, not breathing, and without a pulse, without a heart rate, without any visible sign of life.
And are those some of the things that may be different than someone, let's say, who is experiencing a seizure or a fainting spell? How do you kind of tell the difference?
Right. Well, people who faint tend to recover fairly quickly, and they may not even completely stop moving or completely lose consciousness during the fainting spell. So fainting is extremely common. I think up to 30 to 40% of the population at some point in their life will experience a fainting spell. So it's a common event, and there is no loss of evident loss of life. So the person's still breathing, they still have color, they still have pulse. Again, they may not completely go out, they may just be kind of in between, and if they're speaking, it may be very incoherent, it may not make any sense. And the recovery is pretty quick, because with passing out, most cases, because of a decreased blood flow to the brain, decreased oxygen delivery to the brain, that's usually has to do with the nervous system and the heart not being on the same page as each other. And when you kind of start to fall, or you start to pass out, or you grab for the chair and you go sit down or lay down, some of those changes are already starting to correct themselves, and the blood pressure is able to get to whatever blood pressure you may have at that point, is still able to create brain blood flow circulation. So so it is a very transient and quickly kind of fixes itself. Seizures, classically most seizures are associated with some involuntary movement. Seizure activity is a very hyperdynamic state. So most people who have seizures, their eyes are open, they are, and they may be rigid, or they may be moving in some way or another. And so those are obviously not going to be sudden cardiac arrest, because there's life to the body there. They're moving. They're whether it's involuntary and not under their own control, it's still there nonetheless.
So if you come across someone laying on the ground, not responding, not talking, not moving, it would be pretty safe to assume, or at least explore the possibility that they are in cardiac arrest. Correct. And I think that would probably be the wisest assumption to make, kind of assess the situation. Now, the approach that medical care providers take to sudden cardiac arrest is different than the approach that lay people take to sudden cardiac arrest, obviously. And so the way that CPR, or cardiopulmonary resuscitation, is approached is a little differently. So, for a lay person, it's going to exclude the pulmonary resuscitation aspect of CPR, and so you're really not going to have to worry about doing mouth-to-mouth resuscitation. And that seemed to be one of the biggest causes for hesitation in most people for performing CPR, because they were worried about communicable disease, could they catch something, or just kind of generally grossed out by the idea of mouth-to-mouth resuscitation.
And so there were several studies that looked at, well, is that something that we can leave off? Is that something that's absolutely necessary? And how do people who do not get the mouth-to-mouth component of things compare to people who did? And as it turns out, people who did not get mouth-to-mouth resuscitation did at least as well. And when you kind of combine several of the studies into one large meta-analysis, there was actually an improvement in the people, more improvement in the people who had chest compression only CPR initiated by the bystander on the scene. So it improved these people's survival rates. It doubled it, actually. So you can't overstate the importance of bystander CPR.
I want to talk about that right now. You were talking about the change made, how you don't have to do the mouth-to-mouth anymore. It seems there are changes every few years, and if you learn CPR, maybe it changes and you can't keep up. Tell us how to do it right now. What's suggested?
Well, when we talk about basic, life support or CPR for the lay person, generally the first approach is to approach the person on the ground and kind of aggressively try to wake them up, not to induce an injury, but see if they're alive, see if they're awake, if they're awakeable. If they're arousable, then there's no CPR need to be done. You just need to find some help for the person. If they are not arousable and there's no sign of life, then calling for help first and foremost, because one of the things that is a predictor for how well people recover after a sudden cardiac event is how quickly you can restore spontaneous circulation, and that in most cases has to do with how quickly you can deliver the electrical shock to the heart if it's in a shockable rhythm. So the biggest thing is call for help, get help, and then and initiate chest compressions. And so for chest compressions, generally you're going to want to kind of be over the top of the person with your hands your fingers interlocked, your palm on that person's chest, the center of the chest. They generally say kind of a couple finger breaths or 3 finger breaths above the lower portion of the sternum, but you don't have to be that exact. This is a time where a lot of adrenaline is flowing, where you're maybe not thinking every step A, B, and C, and you don't have to think about step A, B, and C to save that person's life. So in fingers interlocked, elbows locked, and then if you can, you press using your torso. So you want your shoulders over the person's heart, and then you press using your torso. And generally what you'll do is you'll line up kind of next to the person if they're laying out like that, and you'll be on their chest, and you'll do chest compressions with your knees on the ground. So kind of a straight line from the shoulders to the palm to their chest, and then 2-inch kind of compressions, and about 100 or so beats per minute is kind of, or compressions per minute is what you're looking for.
So just to overview, step 1 is try to arouse or wake up the person, make sure that they are not responding.
Right.
And then step 2, call for 911 if you have a phone, or you can tell someone else to call for 911 to get that help coming. And in the meantime, until that help gets there, you do those chest compressions like you were saying.
Right. So, no need to stop. You want to go deep, and you want to go fast. And you don't want to interrupt those compressions if you can help it. So the depth of the compressions, the proficiency with which you perform the compressions really can impact the survivability of that person. And then the second thing is, if you have access to one of those AEDs, the automated external defibrillators. So those devices are kind of neat. The device will tell you what to do. Most of them have a verbal cue, and these little sticky kind of pads that you put on the person's chest. It does require taking their clothing off because it has to go against the skin, but you either stick it in the front and then along the side, or some people will stick in the front and on their back, kind of in a line. But all of the devices show exactly where to put those sticky pads, and then what exactly to do. Once you put the sticky pads and you turn the power on, the device pretty much does the rest, and it will tell you if it's a rhythm that would benefit from the delivery of electricity. That's typically what's called ventricular fibrillation, or VFib, or can be what's referred to as pulseless ventricular tachycardia, or pulseless VTAC. So the device will look for that, and if it finds it, it will tell you to deliver a shock, and you just push a button, and it's very very user friendly. Even if you've never used one before, you can look at it and it tells you exactly what to do. And those devices can be very life-saving, and if you've got 2 people, that's a perfect opportunity to do that. One person can be delivering chest compressions while the other person's setting up the AED, and if you can deliver a shock, you have a much greater likelihood of saving that person's life and having a better neurologic outcome after discharge from the hospital.
So you said if there's 2 people, you need to be doing the CPR and the AED at the same time. Do you have to stop when the shock comes?
Yes.
Do you have to get off of the person?
Yeah, it'll tell you to clear away.
Tells you that
it'll
too,
tell you
right?
to clear away, and it'll tell you to clear away and then deliver the shock. Yeah.
What if there's only one person? Which one is better, an AED or the chest compressions?
Well, there was a study that kind of looked at that and whether or not you needed to have about a 2-minute window of chest compressions before delivering the shock, and there was really no difference in outcomes. So the AED becomes an extremely important device. The timing to delivery of the electrical shock to the heart in a patient in a shockable rhythm is probably the single biggest help that you can provide. And if you can do that on the scene, then you greatly improve that person's chances of recovery. For every 10, I said that backwards. For every 1 minute delay in delivery of the shock, there is a 10% loss of chance of recovery. So minutes count, and after 12 minutes of a non-perfusing rhythm, you're left with some permanent neurologic damage. So, and the chance of recovery drops to 2 to 5%. So, we're talking about an entity that actually has very low likelihood of survival, generally on 25% of patients or so. At best, with a shockable rhythm, will live to exit the hospital neurologically intact. And so we're trying to do whatever we can as early as we can to improve that person's odds.
So we know that the chest compressions, you said, keep the heart pumping and the blood flowing throughout the body. The shock, is that trying to get the heart back into the rhythm, or what exactly is that doing?
That's it, exactly. It is trying to, it's almost, you never want to say never, but it rarely, if ever, occurs that you go into ventricular fibrillation, that you will naturally come out of it. So the sequence of events is once you've developed ventricular fibrillation, is that continues to become more and more disorganized, and eventually leads to no electrical activity at all because of the time that's passed with oxygen deprivation to the heart muscle as well. So you're looking at neurologic and heart muscle kind of outcomes kind of working together, trying to maximize that person's recovery or chances of recovery. And so the electrical shock reestablishes the norm. The hope is that the electrical shock reestablishes the normal electrical function, which will generate the squeeze and the normal return of spontaneous circulation.
Back to those compressions a little bit. You did describe how to do them, and you said about 2 inches down in the center upper chest and fast. But if somebody's kind of unsure, I have heard that you should sing a particular song when you're doing the compressions. If you're not quite sure how to do them, the Bee Gees, staying alive, and just go every time with the beat for that. Do you suggest that? Do you think that's an okay thing to do?
If that makes it easier for you to remember, and that makes it easier for you to perform in the situation, absolutely. Whatever it takes for you to feel comfortable doing the procedure, providing those chest compressions. If that's even if that's something that helps distract you from what you're doing, and you're someone who has difficulty providing any kind of medical help or assistance or anything like that, if that's what it takes, that's fine. And actually, that does kind of give you the right beat, the right number of chest compressions. So.
Our director said in my ear, Dancing Queen by ABBA also may work. So if you like that song better, maybe do that one.
Whatever your favorite,
fast kind of beat song is. Like, you're right too. I mean, those situations can be really high stress. Your brain is probably racing. If that can help you concentrate, that might be a good thing to keep in mind.
Yeah.
Are there some signs that CPR might not be appropriate? I'm sure people in that situation, you might be hesitant if you've never done it before, if you've only heard about it or thought about what you might do, and you would be afraid, is this the right thing to do? We talked about the signs when you should do it. If someone isn't moving, not responding, is there anything that you can tell people that, if this is happening, you don't need to do it?
Well, I mean, not particularly, other than if the person is if the person's fighting you off, obviously you don't need to do CPR.
Don't want to do CPR.
And I think there have
then.
been a few movie scenes that kind of joke at that. But if the person has circulation, if the person has a pulse, if they are breathing, then CPR is not necessarily supportive, kind of just watching them, supporting them, keeping them safe until the help arrives is really all you can do as a bystander. If you do see somebody collapse and they are still breathing, then their heart's still beating. You're not going to be breathing and have an absence of pulse. So if you can see that the person's breathing, their heart is still beating. They may not have the greatest blood pressure at that point, and that may be why they collapsed, but it's still going. So the best thing for you to do then is to kind of, as a bystander, immediately call for help. If there's more than one of you, then call for help and kind of watch over that person to try to keep them safe in whatever environment it is that you're in until help can arrive.
Going back to that thing about being nervous about doing it, is there any way you could do more harm than good while attempting CPR?
No, as long as it's a person who needs it, there's the only thing you can do is improve things. The only thing that you are going to be doing by providing those chest compressions is helping that person out. Can you crack ribs doing chest compressions? Yes. And the older the person, the more frail the person, the more likely that is. That's a relatively common occurrence. But
that's
if
a
it
better
were me,
option.
That's a better option than death. So you're really in a situation where your choices are death and some other outcome. So you're really kind of, there's really very little you can do to hurt somebody in that situation.
And doing those chest compressions, I imagine you're just supposed to do them until more help gets there. Do you just keep going?
Well, that's the goal. That's why you call for help first, because you want that backup. You want somebody coming that is going to take more advanced approach to that life support. So you want the paramedics to be en route. So you want to. That's why the very first thing to do is to call for help. Call for help if you can get the paramedics there. If you are doing chest compressions and you've not called for help, you could potentially be doing chest compressions for a very long time,
right.
and you're not, and then you're in kind of a self-defeating situation. So the very first thing you want to do is call for help. Call for some backup, get some help there. Even if it's another bystander, call this other bystander over, hey, come help me, and have them do chest compressions, and you call 911 or vice versa. But somebody needs to be trying to get the paramedics there as quickly as they can.
And if you're blessed enough to have more than one person there at a time, is it okay? I imagine if you're doing that for a long time very forcefully, there's the potential to get tired yourself and possibly too tired to continue. Is it okay to switch out?
Absolutely. It is very tiring, and so you'd be surprised just how tiring CPR can be. Healthcare providers in the hospital, like nurses and techs and people who are around when the physician is kind of generally the one guiding the protocols, will frequently swap out because when you tire, you're getting less efficient compressions, you're getting shallower compressions, you're slowing down, and so you're not providing the circulatory support that you really need to. So yeah, swapping out is recommended if there's more than one person, so that one person can take a break and rest, the other person's energized and can deliver the good compressions, and then you can swap out again. And you want that swap to be very quick,
That's important.
An efficient swap. So communicate with the other person if there's somebody else there, saying, okay, I'm starting to get tired, will you take over? Agree yes, and then okay, take over.
Yeah.
So that transition is as quick as it can be.
I imagine most of the people going through cardiac arrest are grown adults, but there are some smaller, more delicate grown adults, and also I'm sure it does happen to children from time to time. Are there different moves or pressures for different ages or sizes of people?
For chest compressions, as long as you're not talking about an infant, generally no. As long as you're giving that kind of 2-inch compression. Now, with infants, that changes. Newborns is a different story altogether on the force with which you deliver the compressions, but you're still giving a significant compression to the chest wall. Children and infants don't require as much force. Their thoracic cage is still very much consists of cartilage, and it's not completely ossified bone, and so it it doesn't require as much force to give the compression, and therefore also they don't tend to suffer as many rib fractures as adults do as a result of CPR. But yeah, unfortunately, you will see this happen. You'll see CPR cases that don't necessarily have anything to do with sudden cardiac arrest, but maybe a drowning incident or something along those lines. In which case, the rules don't really change. It's call for help and initiate the CPR if you can. If you've been trained in BLS and you kind of understand airway clearing techniques, and that's always an option. But doing the chest compressions and supporting that individual until help arrives is paramount. Now, typically people in a drowning situation don't present with ventricular fibrillation or pulseless ventricular tachycardia. So the shocking may not even occur, and it's more of the kind of supportive things that you can do while help arrives.
And on the other hand, is there anyone who's too young to perform CPR? I mean, you can teach it to anyone who can learn and who can remember it. Is there any age you think you should wait until to teach CPR?
Well, I think kind of teaching or instructing in life supporting measures can happen at really any age where the child kind of understands the basic concepts, but it is not. I don't think there's a definitive cutoff. Okay, nobody below this age should learn how to call for help, should learn how to support somebody. It's something that's taught in Cub Scouts. I know I was a den leader for many years, and then also in Boy Scouts. So young kids do learn it. I suspect it's also taught in Girl Scouts as well. I don't want to leave anybody out. I just don't have any personal experience in that.
Boy Scouts and Girl Scouts.
So no. I mean, I think the first BLS class I took was as a Cub Scout. So it can happen in young ages.
This is something that is probably really on people's mind right now with Coach Rodney Guin from Houghton High School, a football coach who suffered a massive heart attack over the weekend. A lot of people out there thinking about heart attacks, thinking about cardiac arrest right now. I don't know what happened in his case, if someone was there to perform CPR, but that is such a good reminder, right, that anyone at any time, this coach who is such a beloved coach, maybe somebody helped him and performed CPR and possibly saved his life.
And it could have been. I don't know the specifics of what happened. What happened to him either. But if he had suffered a sudden cardiac arrest, then a bystander performing those functions could have been critical in saving his life.
We have about a minute and a half left. I just want to reiterate again what to do. So step one is to make sure the person is basically unconscious, correct?
Yeah, well, and not just unconscious, but not breathing, and no sign of life. And then call for help. Call for help immediately. Don't delay in calling for help. And then if there is no sign of life, if there is no sign of breathing, then starting chest compressions. You can't make anything worse. You can only make things better. So immediately starting those chest compressions after you call for help.
That's huge. And just once again, put your hands over each other, not interlocking fingers, but spread them out, and elbows locked directly over the person's mid-upper chest and down 2 inches.
Right, and 2 inches and fast, at least 100 beats a minute.
And where can people go for more information if they'd like to take a class? Obviously, the Red Cross was where I learned how to do CPR when I had to get licensed to be a lifeguard. Do you think that they're a good resource, or do you know any others?
Yes, the Red Cross is an excellent resource for learning BLS and staying up to date on BLS. And so there can be other online resources. There's a company called Up to Date that also has some helpful information for this kind of a situation.
Very good. Dr. Paul Bracey, thanks so much for that important information today.
Thank you.
Have a great day.